Hey everyone, welcome to Butterfly Learnings again. In today's video we are going to talking about how to handle meltdowns. How to handle meltdowns? Children go into meltdown when they are stressed or overwhelmed and dealing with tough feelings. This differs from tantrums because they need to have a function, tangible, escape or attention. So tantrums are a response if the child is not allowed to get something or do something. Whereas, reasons like anger, frustration, fear, sensory overload cause meltdown. It also happens when children are hungry or restless and at that moment something is asked of them. They may want nothing and still the meltdown will continue. The behaviors the child shows in a meltdown are crying, screaming, throwing objects, hitting self or others. Dear parents, there is no need to worry. It is developmentally normal for young children because they are in an age where they don't have the skills to express that they are angry or upset. How else are they going to express themselves? With the behaviors they already know. So, how will you handle a child's meltdown? There are 3 stages of meltdown: before the behavior, during the behavior, and after the behavior. Let us see what we can do in each stage. What to do before the meltdown happens? 1. Have knowledge about child's triggers. Every challenging behavior has a trigger before it begins, and it differs from child to child. They do not react to the same thing. For one child, it might be frustration and sensory overload. For others, it might be when they are hungry, experiencing pain, or scared about something. Try to observe when the child is having a meltdown. See whether it happens when she is going to school or just before lunchtime or nap time. Or the child may not like to go to a particular place like a noisy or crowded area. Having knowledge about the child's triggers will help you avoid a meltdown. 2. Respond to the early signs. If you address the early signs, then you can prevent a meltdown by calming down your child. Here are some indications you need to be aware of. The child cannot think, make a decision, or answer a question. A child is repeating the same thing. The child is refusing to follow instructions. The child is restlessly moving. It might seem she is pacing or fidgeting. The child wants to escape or cover eyes or ears when she is uncomfortable. 3. Be patient. The first idea which comes to parents is that it might be better to stop the escalation before things become uncontrollable. They try to talk fast and loud. Unfortunately, the opposite happens, and it ends up becoming worse. When you notice the early signs, you need to speak by using short sentences, so the child can understand what you are saying. What to do during the meltdown? 1. Make sure the child or others are safe. When the child is having a meltdown, she might be unknowingly unsafe. She might get hurt or hurt others. You need to make sure that everyone is safe, including your child. Suppose both you and your child are in public, take her to a quiet and peaceful place. At home you can take her to the room, which brings her calm. If moving your child is difficult, then politely request people to give you and her some space. 2. Try to bring the child calmness. During a meltdown, children enter a zone where they cannot control their emotions and, when stressed out or panicked, they struggle to think logically, use and understand language effectively. Check whether the child needs a firm hug or wants some space. You also need to keep the tone of your voice calm and speak very limited words. Just be there. Make the child feel safe or calm. She needs someone to connect with the person trusts the most. After the meltdown. Give your child some time because after experiencing tough emotions and expressing them makes her feel exhausted. Let her relax and regain her calm. When is the right time to correct the child? It is impossible to teach alternative skills when children have a meltdown because they cannot think about what they should do. Once everything is back to normal, inform your child that you need to talk about something important and what the topic will be about. Reassure the child she is safe and won't get punished. Ask your child and understand what triggered the behavior. Teach her coping skills like counting to 10, taking breaths, washing face or methods that are best for her to calm down. If you and your child need to do an activity, for example, going out to buy groceries, make a plan and stick to it. Thank you to everyone for watching to the end. Please comment below what you want to see next, and for more such content please subscribe to the channel.